Hi there, I'm the neuromuscular mechanic, and today we're going to be talking about the diagnostic nerve block of the musculocutaneous nerve. And so this nerve supplies two important elbow flexors, the biceps and the brachialis. And so we can use these nerve blocks to temporarily reduce elbow flexor spasticity coming from these two muscles. And we can block either proximally at the nerve trunk to get both of these muscles, or we can go more distally, getting the selective motor branches to either the biceps or brachialis. And this can be important because it allows us to temporarily reduce tone, elbow flexor tone, to see what a person's function is like. And this can allow us to make more informed decisions about the role of toxin therapy with botulinum toxin, or phenolneurolysis, or surgical neurectomy. So these blocks can be very useful. Now in a second here, I'm going to get the ultrasound set up. So we'll stop here, but I have the probe set up in a transverse plane at the level of the armpit. And so medially or inferiorly is on the left of the screen, and then superiorly and laterally is on the right of the screen. And the large black anechoic structure in the middle of the screen is the axillary artery. And this is an important structure to identify because once you've identified it, you can use it to find the musculocutaneous nerve. And so the musculocutaneous nerve usually is anterior and lateral to this. So in this image, it's at the 3 o'clock position. You can see as labeled here, MCN, that hyperechoic honeycomb structure of the musculocutaneous nerve. And so the blood vessels, like other nerve blocks that I've shown, can be very useful in identifying this nerve. Now in a second, I'm going to move the ultrasound probe more distally. And what you're going to see is that this nerve runs between two important muscles. So here we go. Stop there. So it runs between the BB, or the biceps brachii, and the coracobrachialis, or CB, proximally. And so you can use this to make sure that you've identified the right nerve. And so now we'll move that ultrasound probe more distally, following the nerve there. It's in the center of the screen. Now I'm starting to get at the level of the brachialis, which is under the nerve. And what I've done here is I've highlighted some branches. And so the red arrow is pointing to branches that are going to the superior biceps. And the blue arrow is pointing to branches that are going to the underlying brachialis. So at this level, we could advance the needle to one of these nerve branches. If we wanted to get the biceps, we could go near the red arrow and then provide electrical stimulation, make sure we get the right muscle twitch to provide that selective block of either the biceps or the brachialis. And so here I'm just moving the probe now proximally. Again, there's the nerve in the middle of the screen, right there. And so that is sort of how you can identify the musculocutaneous nerve. And it can be a very important block for elbow flexor spasticity. It doesn't get all the elbow flexors, so it gets the biceps, it gets the brachialis, but remember, it won't get the brachioradialis, which is innervated by the radial nerve. Hopefully, you can appreciate the importance of using the axillary artery to help identify the nerve proximally, and then you can scan from proximal to distal depending on where you want to block. You can again block proximally at the trunk if you want to get both the biceps and brachialis tone, or you could go more distally and get selective motor branches to either the biceps or brachialis. Now, one thing to mention is that if you do block the trunk or the branches to the biceps, you may see depression in the biceps reflex, or if you block at the level of the proximal trunk, you may get sensory changes to the lateral arm and the territory of the lateral antebrachial cutaneous nerve. And so again, you can use these findings to sort of ensure that you had a successful block and you blocked what you intended to. And so that concludes our video. I'm the neuromuscular mechanic, and I hope you found today's session handy.